Hi everyone, Jessica here. If you've been following our Leiamoon page for a while, you know very well that we are passionate about empowering women to better know and care for their bodies. In our research, we came across the work of like-minded expert Lisa Hendrickson-Jack, who I have the honor of interviewing today to share her mind with you, our audience. Lisa is a certified fertility awareness educator and holistic reproductive health practitioner who teaches women to chart their menstrual cycles for natural birth control, conception, and monitoring overall health. In her new amazing book, The Fifth Vital Sign, Lisa debunks the myth that regular ovulation is only important when you want children by recognizing that the menstrual cycle is a vital sign. And she draws heavily from current scientific literature and presents an evidence-based approach to fertility awareness and menstrual cycle optimization. She also hosts the amazing Fertility Friday podcast, which is a weekly radio show devoted to helping women connect to their fifth vital sign by uncovering the connection between menstrual cycle health, fertility, and overall health. Lisa, thank you so much for being here and for all that you share.
Thank you for having me. I'm excited to be here.
So can you start by just introducing yourself, telling us about your background and how you came to write The Fifth Vital Sign?
Yes, I mean, with my story, my experience with fertility awareness is unique in that I discovered it when I was really young. So I was just out of high school, in my first or second year of university when I discovered fertility awareness. So I was about 18 or 19 years old. And so, like many women, I'd been put on the pill for painful, heavy periods in high school. I mean, I didn't really know how else to handle it. And I probably said 3 words to the doctor and he was like already writing the prescription. And so I wasn't using the pill for birth control. I was using it for, pain management. And every time I would come off of it for whatever reason, just to take a break or something like that, the pain would be there and it would be worse, the same or worse. And also because I wasn't using it for birth control, I wasn't always taking it at the same time every day, but I was always the nerd that I am. And so I had read the entire insert and I knew that if you weren't taking it at the right time, it wouldn't be as effective. And I felt like I would always be nervous about whether or not it was working when I actually did need birth control. So around the age when I actually did need birth control, I decided that I was kind of like, okay, so if I don't fully trust the pill, I'm always going to use condoms. And then I was like, but if I'm always going to use condoms, why use the pill? Because I was also kind of nervous about my fertility in the future. Like I didn't want kids at like 18, but I knew I wanted them at some point, and I had some reservations just about, I saw some of the members of my family have challenges with fertility. I knew I had these really heavy, painful periods. My mom had struggled with fibroids for years and ended up having a hysterectomy. And I kind of just had this sense of like, this isn't normal. And I really want a different future. Like I want to figure out what's going on. So it's right around that interesting time of contemplation and what am I going to do that I discovered fertility awareness. And so for me, that was the first time that I had ever learned that I wasn't fertile every day. So I distinctly remember in my junior high school education class that the teachers told us there were no safe days. We could get pregnant as women every single day, regardless. And so I just left that at that stage of my life, feeling really terrified, scared that I could get pregnant at any time. Not really understanding why. So it's like this imminent threat, but I didn't understand it. And then when I discovered fertility awareness, it was like, okay, no, there's only a short window of fertility. You can identify it by tracking your mucus and your cervical position and your temperature, and you can use it as birth control. And there's, it's evidence-based, there's science behind it. It's up to 99.4% effective. And so I was like, yes, that is what I want to do. And I like to share that because I was a young woman. I was in my late teens, early 20s. And after, so I, ran out taking charge of your fertility. I also happened to live in Edmonton, Alberta, and that's where Justice Healthworks for Women was located physically. So it just so happened that on my university campus, there was a group of women who were trained teachers and were running monthly workshops. And so I just attended and never stopped attending, and eventually trained and started teaching. It's like they couldn't get rid of me. But that basically was my kind of window into this. And so, fast forward a decade, I had used fertility awareness to avoid pregnancy throughout my entire 20s successfully. So I like to say that too, because it works, when you learn how to use it correctly, and you follow the rules and you continue to chart, it is an effective method of birth control, as effective or equally to the pill. And then when my husband and I decided we wanted to start a family, we basically flipped the switch and had sex on the other days, had unprotected sex on the other days. But basically just around that time, I was in my early 30s, and I kind of looked around and realized that even though I had known this information all these years and had the privilege of teaching it to women, the average woman still has no idea how her cycle works, how her body works, how that she's not fertile every single day of her cycle. And a lot of women are struggling to conceive and still not understanding even just like how to time sex accurately. So I felt this obligation to spread the word. And that out of that came the podcast and now the book. And so it's a really long answer to your question.
No, it's great. I mean, it really is amazing that at such a young age you had like the foresight to like research just a bit further, or that maybe it was just this fateful event that on your college campus you also had the opportunity to connect with women that were teaching fertility awareness. So I'm remembering on my college campus, I think birth control pills were free, and I remember my roommates being like, oh, we have to go down to the health center because we can get our birth control and our condoms. And I also like had never really heard of the pill before that, and it just feels like it's so quick to be given away and prescribed to women at such a young age before we really have the right information about our bodies to make an informed decision. So it kind of feels like it's this intentional thing where they're like, okay, here you go, get into this stuff because this will be the rest of your life. And so it feels like the work that you're doing is really trying to turn that on its head now and give women options without feeling like this is the only solution.
Mm-hmm. Well, it feels like there's this kind of, in addition to what you said, it's like this fear of, it's like if we tell women what's really going on, then they'll know. So even among women who learn and understand the fertility awareness method, there's often this question of, should we be teaching it to teenage girls? How young should we be teaching it to them? And it's kind of like this fear that if we teach them that they're not fertile every day, they're going to go and have sex. Well, newsflash, they're already having sex, right? Like but it's really just interesting, this notion of wanting to suppress that truth, because really when you have the information, you're able to make better choices. So I'm with you. I don't really understand the hesitation of just making this information more accessible to women.
So can you explain to us what fertility awareness method is, and like how do we do this?
Yeah, I mean, in the most basic sense, fertility awareness is developing an understanding of your cycle so that you can identify which days of your cycle are fertile and which days are not. And then when you have that basic understanding of, okay, this is how my cycle works, this is when I'm fertile, then you can choose whether you want to use that information to help you to avoid pregnancy naturally, so as an effective method of non-hormonal birth control, or if you're trying to conceive, then helping you to optimize, have sex at the correct time of your cycle. For some women who are trying to conceive, just by understanding the correct time will help them to conceive. Obviously, fertility is complex, so it's not always that simple, but for a certain percentage of women, it's literally like, let's get the days correct, and they'll be able to conceive. And then a third, just in general, because your menstrual cycle is connected to your overall health, you can also chart your cycles just to get a sense of what's happening health-wise. And as you make different changes, diet, lifestyle, different things, you can actually see that reflected in your cycle if you're on the right track. So for some women, they're just going to follow their cycles for health reasons.
Mm-hmm. Yeah, and I guess the title of your book, The Fifth Vital Sign, is basically saying like that our menstrual cycle is a vital sign. Can you break that down a bit more? Like what is a vital sign? What are our more typical vital signs, and what makes the menstrual cycle also a vital sign?
Mm-hmm. Well, I mean, there's a growing number of healthcare practitioners who are acknowledging that the menstrual cycle is a vital sign, and essentially a vital sign is a measure of how your body is functioning. Mm-hmm. And the most common vital signs that we're familiar with are, say, your blood pressure, your heart rate, your respiratory rate, so how many breaths that you take each minute, and your body temperature as well. So those would be the most common. And we all have a general understanding that, there's a normal range of each of these signs. And if you were to go to your doctor and one of those signs was either too high or too low, that not only would it give the doctor specific information just about just that there's something wrong, but it would also give a specific indication for the doctor of like, okay, typically when the blood pressure is elevated, it could be these things. So then it gives a roadmap as to we should be looking here. Mm-hmm. And so the menstrual cycle does very much the same thing when you're working with a person who has that insight of how the menstrual cycle could be related to health. And typically when I talk about the menstrual cycle, a lot of women just think your period, right? And so when I talk about the menstrual cycle as being a vital sign, I mean the whole thing. So it's not like you just have your period and then like fast forward and then next one. In a healthy cycle, just to kind of take you through, the first day of your cycle is the first day of your period, your true flow. So when you actually have to, I always say like when you actually have to get something, to deal with it. But so if you have a couple of days of spotting before your period starts, then we wouldn't count those as the first day. We would count the first day as the first day of flow. And so, the whole menstrual cycle, you have your period typically lasting anywhere from, 3 to 7 days. And then as your period comes to an end, you typically have a few days before you start to see your cervical mucus. And so cervical mucus can either look like creamy white hand lotion, or sometimes it can look like clear, stretchy, kind of like raw egg whites, or just, you go to the bathroom and it feels really slippery when you're wiping. But as you approach ovulation, you would typically expect to see about 2 to 7 days of cervical mucus. In a healthy cycle, you would ovulate. So that's a really important aspect of it. And then, after ovulation, your period, you would expect it to come in 12 to 14 days. Or if your period doesn't come, you would be pregnant. So there's basically two options there. And so, if I break that down into what happens, in the pre-ovulatory phase and then the post-ovulatory phase, within each different aspect of that, we can gain information about overall health. So if we look at the period, if the period is extremely heavy and painful, that can give us some information that we should be, important information that could indicate a problem that we should be looking into. If your period is too light, that could indicate a hormonal imbalance or something like that. If you don't ever see cervical mucus at all, that would indicate a potential issue with your cervical health. If you see mucus every single day, that could be indication of something as simple as a yeast infection or something more serious. Even abnormal cervical cells can come up with consistent watery discharge throughout the cycle. If you're not ovulating, that would give us an indication of something that's happening. And also even just the length of your luteal phase, if you see spotting throughout your cycle. So it's just helpful to have that understanding of like, there is a normal and healthy cycle, and there are normal and healthy parameters of that. And if your cycle or certain aspects of your cycle regularly fall outside of that, and I think that's important as well, because every woman will have the occasional kind of random thing that happens in their cycle. Mm-hmm. So we can't necessarily say that if once you have some spotting, that indicates a huge problem, because a lot of people will have spotting once. But if you look at the consistent patterns throughout your cycle, for many women, especially women who are charting and paying attention to these things, there's many cases where those subtle changes in your cycle can be the early indication, even before you would think that there's something wrong.
So what are the biggest disruptors then to what like the normal cycle would be for a woman?
I mean, if you think about the menstrual cycle as a reflection of overall health, mm-hmm. then there's a lot of different aspects of just life that can affect it. So it could be something like stress, and chronic stress even can affect the cycle a bit differently versus acute stress. So for example, and then when I say stress, we often think of like bad, like horrible boss or, something, but it could be even going on a vacation. If you get on a plane, your body's all of a sudden 4,000 feet in the air. So your ovaries are kind of like, what's up? So that could be a stress, even though it's not bad. So if you experience some sort of acute stress prior to ovulation, it's really common for ovulation to be, say, delayed a little bit. If you have a health issue, so for example, women with PCOS is characterized by insulin resistance, inflammation, and that can disrupt ovulation, which is why women with PCOS, the characteristic PCOS cycle has a delayed ovulation. So women, who fit that description typically have longer cycles. So it can be something like stress, it can be something like a health condition that's happening in your body. when I'm working with women, I've seen women who have gut issues. So for instance, if a woman has some degree of IBS and she has some food sensitivities or allergies or something like that, and she exposes herself to those foods, that can affect her cervical mucus production. So I've seen women who, let's say they have a sensitivity to like dairy, let's pick on dairy, for example, and they eat the dairy and they have a sensitivity to it. They have some degree of mucus, throughout their cycle. And then if they stop consuming it for a while, they might see that shift back to more normal mucus patterns. So those are just a few examples, and I really could go on. If a woman has endocrine issues, thyroid issues, issues with her, the conversation that goes on between your hypothalamus, pituitary, ovaries, so HPO axis dysregulation, it's just really interesting. And so you can't necessarily look at the chart and say, okay, this is exactly what's going on, right? You can't make like a quote unquote diagnosis. You need your doctor to, do the test to make an accurate diagnosis, but you can get those subtle and kind of specific indicators that would let you know, okay, you should look here to see if there could be something wrong, or you should look at this, or this isn't normal. You should know that that's not what we would expect to see.
So when your menstrual cycle is off, which you can tell by regular tracking, that's an indication that there might be some other aspect of your health that is out of whack. It doesn't necessarily mean it's only your reproductive system that's misbehaving. It's more of a response.
Well, yeah, I think that one of the myths just in general as women that we're working to overcome at this interesting phase of, because right now it's a really great time for periods. There's within the year, there's been, I don't even know all the books that have come out about periods, but even just within the year, there's a lot of women talking about it, writing about it. Periods, it feels like they're getting their moment, and we're starting to really recognize that the menstrual cycle is important. But there's this myth that your cycle only matters when you're trying to have kids, and it's really only related to reproduction. So if you're not actively trying to have kids today, who cares? You can shut down your cycle with hormonal birth control. It won't have any effect on your body, and all that kind of stuff. My analogy for that is, if you or I were to go to the car dealership, so we wanted to buy a car or something like that, I could get the car with air conditioning, or I could get it without air conditioning, or I could get it with heated seats or without heated seats, and it wouldn't affect engine functioning. And somehow we think of our ovaries that way. We think that we can like turn them on and off with hormonal birth control, or if our cycles stop for whatever reason, we kind of think that it doesn't affect our just regular functioning, because we kind of think that our ovarian function and our menstrual cycle is only related to having kids. But when you look at what happens when you interfere with normal ovarian function, so when women have disrupted cycles, such as the case is the case with PCOS, and they have a really delayed ovulation. So a healthy cycle, you would expect it to be somewhere between about 24 and 35 days, with an average of about 29 days. So in that type of cycle, you would expect that, the first half of the cycle, your ovaries are producing estrogen. So your first half of the cycle is characterized by a higher estrogen production. And then after ovulation, you produce progesterone. And so you kind of have, it's not like a perfectly equal balance or anything, but you would expect to have about as many days where you're producing significant estrogen as you would where you're producing significant progesterone. And these hormones have different roles and they work together. Progesterone mitigates some of the negative effects of estrogen. Estrogen is characterized by cell proliferation. So, I mean, I could go on, but in the example of PCOS, for example, then a woman would typically have cycles that are longer. So if her cycles are 45 days, or I actually spoke to a woman yesterday who told me that when she was trying to conceive, her cycles were like 75 days kind of on average. So that would mean in a 75-day cycle, you would potentially have like 63 days of, pre-ovulatory, because, your period comes after ovulation, and the second half of your cycle is typically about 2 weeks long. So 62 days, let's say, of estrogen dominance, and then you have the 12 to 14 days of progesterone. So women with PCOS, for example, are at an increased risk of developing endometrial cancer because they're just exposed to estrogen for such a long period of time. So it's just to show that there's more to your cycle than just your ability to reproduce. And another example I'll share is hypothalamic amenorrhea. So that is a different situation where, so typically women with hypothalamic amenorrhea, it just means that they're not ovulating, and so they're not menstruating. And it's typically related to a combination of overexercise, undernutrition, and stress. And so basically something is happening where the connection between the brain and the ovaries is not happening. And when women lose their periods for, say, 6 months or more, and this continues, so they're just not ovulating, they're not menstruating, they're at an increased lifetime risk of developing osteoporosis. So it turns out that our ovarian cycle is related to how we develop and maintain bone mass. And so obviously my bone development is not related to my ability to bear children. So it's really helpful to kind of get out of this myth that our cycles only matter when we're trying to have babies, and understand that they're important outside of that.
So then, yeah, that's amazing, really. I mean, of course, it's all connected. So I guess that even in your book, the way that you kind of frame what synthetic hormones or birth control pills do to what we believed were regulating our cycle are making it actually like just sort of mute in the way it communicates with the rest of our body. So maybe you can speak a bit more on that, because yeah, what you were just describing, how all of these different systems within our body are communicating with each other, just like the car dealership analogy, like what happens when you just decide to kind of a la carte pick and choose which systems we shut down.
Mm-hmm. Well, I mean, I feel like a lot of what I do is myth busting. And so when I was writing the book, I did some research just into the history of the pill, just to kind of be able to explain it in a concise and accurate way. And so as I was looking up the research, when the pill was first developed, before they brought it to the market, they did some testing. And so just picture it's the late 50s. There's never been a pill on the market before. So the women have no precedent for this. So in one of the early iterations of the pill, the individuals who created it, they gave the women the pill, but they hadn't created the withdrawal bleed yet. So there was no break. They just took the pill and they just stopped menstruating. So one of the myths about the pill and other types of hormonal birth control is that it regulates the menstrual cycle. So if your cycles are irregular, you can take this pill and then magically your cycles are just regular now. But what the pill does is actually suppress ovulation in most cases. And then so when you're not ovulating, you don't have a period. So the women in that early, in the late 1950s and that like early kind of pill development phase, some of those women were actually trying to conceive. And so when they were creating this drug, they were also trying to kind of, maybe kickstart the cycle. So there were women in there who were actually trying to get pregnant. And so when they saw that their periods weren't coming, they thought they were pregnant. And then the doctors were like, no, you're not pregnant. This is because of this pill that you're taking. But the women, there was no precedent for this. So they were like, I don't know what you're talking about. I'm pregnant. The only reason I wouldn't have my period is either because I'm pregnant or sick or breastfeeding. And so I must be pregnant. And so, the women were absolutely devastated. And when they actually discovered that it was the drug that wasn't the drug that was causing them not to have their period. So what happened was, from the very beginning of when the pill was first released on the market in 1960, what they did is that they created that fake 28-day cycle. So, any woman who's ever taken pills out of a pack will know that you take it, maybe for 21 days, or the number of days might be a little bit different, but you take it for 21 days and then you get 7 days of a sugar pill or just 7 days of not taking it. And then you get this bleed. And so that's how, from the very beginning, basically women were lied to about how the pill works and told that it was regulating the cycle. And what it's really doing is halting your cycle completely, so you don't have one anymore. And then when you stop taking the synthetic hormones, and so the synthetic estrogens and progestins in the pill are not the same as what's in our body. So even when you hear someone saying, oh, it's just estrogen and progesterone in the pill, it isn't. In order to patent and sell drugs, you have to create hormones that are similar enough to our natural hormones, estrogen and progesterone, to fit into our receptors, but different enough so that you can patent them and sell them, right? So basically, I mean, from the very beginning, we were told that this is what's happening. And even to this day, when I try to bust some of those myths and like create posts and post them and talk about this, there's always a lot of women that come, because we've never been told this. So there's always a lot of women who are like, what do you mean? You know, my whole life I thought that this was regulating my period. I thought this was the solution to my irregular cycles. And I really, like, I'm bleeding, so how is this not a real period? And so you only have a true menstrual period after you ovulate, about 12 to 14 days later.
Mm-hmm. So fascinating. And same with IUDs then too. I mean, I guess most IUDs eliminate the period altogether. Women are celebrating that. And it's also advertised in such a way where it is like this miracle thing. But I think the research that you're presenting is that this is not healthy for us. It's really hard to convince a great population of women now that feel like this is a victory, that it's actually disrupting so many other pieces of our, you know, of our whole being that are kind of shutting down now. So what, yeah, I'm not sure, like what do you say to those women that are really like?
Well, I just want to mention with the IUD that, so there's different types of formulations. So the most common and widely used types of birth control, whether it's the pill or the patch or the ring, are typically a combination of synthetic estrogens and progestins that work primarily by suppressing ovulation. But it's not, when you look at the research, ovulation isn't necessarily suppressed 100% of the time. And so the three main modes of action would be A, suppressing ovulation, so shutting down ovarian function, and basically interfering with the normal function of your endocrine system, because that's what you need to do to prevent pregnancy, right? If you stop ovulation, you can't get pregnant. But in addition to that, one of the other modes of action is to prevent the production of fertile quality cervical mucus. So when you're on the pill or other types of hormonal birth control, it actually fills your cervix with a thick mucus plug, so that you would naturally produce that outside of your fertile window, but basically the pill just prevents that from changing. So it's just always like that. And then the third mode of action would be that when you're using hormonal types of birth control, the uterine lining, so if they measure the width, the thickness of your uterine lining via ultrasound, it's very, very thin. And so in order to get pregnant, your uterine lining has to be a certain level of thickness. And so these drugs prevent the lining from ever fully forming. And so even if, for example, you're using a type of birth control and you don't ovulate, there would still be these other two backup measures to really reduce the chance of you getting pregnant, having a successful pregnancy. And so with the IUD, there's two main types, broad categories. There's hormonal and non-hormonal. And typically the hormonal IUDs are progestin only, so there's no estrogen. So they don't always suppress ovulation. I think the myth, though, is that you get to keep ovulating and have your normal cycle. So when you look at the research about hormonal IUDs, there is a percentage of women who continue ovulating. There's a percentage of women who stop ovulating, and there's a percentage of women who ovulate more sporadically. So maybe they ovulate every once in a while. And so with the IUDs, one of the primary modes of action, the progestin releasing IUDs, one of the primary modes of action is to prevent that uterine lining from ever fully forming. And then there's other progestin. So I just wanted to clarify that, because I know I often get questions about that, because there are women who choose the IUD, for instance, the hormonal IUD, because they're able to continue ovulating. And so it's helpful to clarify that it doesn't mean that everything is happening normally, because you are still getting a dose of hormones. And often those IUDs are promoted as low dose. And it's interesting, you can call it what you want. It has to have enough hormone to just prevent you from getting pregnant. So we can call it high dose or low dose. So we can look at the dose, but it has to be enough to disrupt the normal system, enough to prevent you from getting pregnant. And also with the IUDs, I hear a lot of women talking about how it's like localized. So you have a circulatory system. So it's not like the progestin just stays in your uterus, like it moves around.
Yeah. Wow.
But you asked a question. I kind of went on a tangent about the IUDs, but you had asked a question about how to maybe refresh me.
Well, I was just kind of curious, because there are so many different types of contraception now that deals with hormones, and some are kind of sold in a way that makes it seem like your cycle is still functioning as normal. And like, you answered the question. I mean, it really was sort of understanding which aspects it does sort of target to prevent pregnancy, which there there's a spectrum of, but still what it's doing is shutting down pieces of what would naturally occur. So like the fertility awareness method that you're talking about just with charting, that seems to be the one way that we can prevent pregnancy if that's the goal without disrupting all these other parts of our bodies. And that it's still how effective, would you say?
Well, I mean, there's been research done. So one of the research studies that I quote in the book is the Frank Herman study. And so in that study, they had women, they tested the symptothermal method of birth control. So I teach a version of the symptothermal method. All that means is that you're combining the symptoms, so your cervical mucus and cervical position observations, with the thermal, the temperature charting. So you're using both. And in that particular study, they had women who were taught a specific method of charting by trained instructors. So it wasn't the effectiveness when you teach yourself. I don't know that that's been studied necessarily in a scientific, reliable way. But when these women were taught a specific method and they were following it accurately, the effectiveness rate was 99.4%. So that's with correct, perfect use. Obviously, there's a difference between what they call like user failure and method failure, and then there's a difference between like using the method correctly and not really charting and getting pregnant, but you weren't really charting. So I think that it's helpful just to know that, the user failure rate is different with any contraceptive method. So even with the birth control pill, the perfect use effectiveness rate is like 99 point something percent, but with the typical use is more like 92%, even with the birth control pill. Yeah.
Do you encourage your clients to use the fertility awareness method? Like, are there apps that you recommend, or like, how do you get people to really commit to this?
Well, I mean, women who come to me, they're typically like ready to go. By the time you get to me, you're like on board. So the way that I think of it is that charting isn't for everybody, just like condoms aren't for everybody. Like everybody doesn't love condoms. It's like the dirty little secret people don't talk about it, or the pill isn't for everybody, or the IUD isn't for everybody. So there's a reason why we have all of these different options when it comes to managing our fertility. And so I'm the first to say, and it might seem strange as a fertility awareness educator to be like, no, charting isn't necessarily for every woman or for every point in your life. So for some women, charting might be really appropriate at one stage of their life, but at another stage of their life, they might opt for a different method of birth control. And so I think that it's just really important. We're all, I'm assuming, adults here, or at least close to. So having the ability just to have that openness in terms of that conversation. So because charting your cycle, that appeals to a certain type of woman. This appeals to someone who's really interested in what's happening with her cycle, who is actually on some level really fascinated by it. She's highly motivated to not use hormones. And so for some women, there's some women who've had a really negative effect on birth control. There's a long list of side effects associated with hormonal birth control that we could go through. And not every woman has the same experience. Some women use it and really don't notice a lot of difference. So maybe they notice after they come off the difference in how they feel and their mood and energy and stuff like that. But other women, they go on it and they immediately have a negative reaction. There's some women that just can't use birth control because it just causes such a negative reaction for them. So the type of woman who is interested in fertility awareness is often very motivated to do it. So I don't have to like try to get women motivated because when they come to me, they're already motivated. They want to do this. And so really what it comes down to, though, it sounds like a lot of work. Like you're checking for cervical mucus every day, you're checking your, cervical position if you choose to, you're taking your temperature every day, you're writing it all down, you're interpreting the data, you're modifying your sexual activity, God forbid, what I mean? Like on some days you have to use protection, on some days you don't. So there's all of these factors. And so it can sound like it's really, really complicated. But what I always say is like, did you brush your teeth this morning? I'm guessing you did. And did anybody have to tell you? Did somebody have to like harass you? You probably just picked up the toothbrush and did it because you've been doing it for so many years that you're just in the habit of it. So when you start charting, part of the challenge is to develop those habits. But once you start charting your cycles, it's very similar to any other habit like brushing your teeth, where you're not going out of your way to check for cervical mucus. Like, you know, I'm sure that everyone watching this went to the bathroom at some point today. Like, no one had to tell you to wipe yourself. So you're just like paying attention when you wipe yourself. Taking your temperature in the morning. It can be an inconvenience for some women, but for others, it's just literally just putting the thermometer in there before you get out of bed. So it doesn't have to be this, this big crazy thing. It's literally just developing a habit. And so for the women who are interested in fertility awareness and feel that this is the right birth control method for them, they just do it.
Mm-hmm. Do you feel that like the more data, I guess, that you get about your own cycle, the more you start to really appreciate it and enjoy it? Because there is like this shift happening right now, it seems, in like the wave of women embracing their menstrual cycle and period and really appreciating the significance of seeing it.
I think so. But I think it can be, so one of the things that I see happening is, I mean, when you discover that your cycles are more than just about having babies, and you discover that your cycles are reflecting your health and that you can actually tell when you're fertile, when you're not, it's obviously really exciting. It's something that most of us haven't been told. So we kind of get into this like romanticized notion of like, this is amazing and beautiful and wonderful, but not everyone's cycle looks like it does in the textbooks. So, you know, when you learn about fertility awareness, so if you like read my book or you read Taking Charge of Your Fertility or devour whatever resources on fertility awareness, you'll typically see like this picturesque 28-day cycle, ovulation happening around day 14. And a lot of women get into what I call rhythm method thinking, where they really think that they should be able to anticipate when ovulation is going to happen and think their cycle should be looking about the same all the time. Excuse me, but as we talked about, the cycle is reflecting your overall health. So there's a lot of women out there struggling with different challenges, whether it's hormonal imbalances, endocrine issues, gut issues. There's just a lot of different things that women are struggling with these days. And any number of those things can cause you to see different patterns in your cycle. So I do think that what happens when you start charting, especially for women who continue and they chart for several cycles. So any woman who's charted her cycles for 6 months, a year or more, in my case, almost 20 years, you start to see patterns, but you also start to see that you have a lot more impact on your cycles and your health than you thought. So if you're charting your cycles, let's say for 2 years or more, I'll just throw a random number out there, then you've probably made a few changes here and there. Maybe you tried a different thing with your diet. Maybe you added exercise, took it away. Maybe you started sleeping better or worse, or you went through a stressful time or something like that. You really start to see how these things impact your cycle. And the term body literacy, that's a term that I became familiar with when I learned, you know, to teach women how to chart and became a fertility awareness educator. And I believe Laura Werschler was the first to she coined that term of body literacy. Mm-hmm. And in the general sense, it just means having that awareness of your cycle, how it works, how to identify when you're fertile, and also how the different things can affect your cycle. So the more you chart, the more you develop that body literacy. And it's very empowering because you start to realize that, I mean, there's a lot of women who have had the experience of, you know, I think there's something wrong with my cycle. I don't think my periods should be this heavy. I don't think they should be this way. I'm seeing this weird stuff, you know, that I don't think I should be seeing. And you go to your doctor and you're either told like, go on the pill, there's nothing wrong with you, everything's fine, whatever, you know, you kind of dismissed. It's like this whole theme of the way medicine treats women a lot of the times. Hopefully that's changing, but for now that seems to be the experience of a lot of women. When you start charting and you start to see, oh, wow, if I drink wine a lot, this is what happens. Oh, if I like kill myself at the gym for 7 days straight every week, this is what happens to my cycle. Oh, if I have like a raging thyroid disorder, this is what happens to my cycle. You know, like if you start to see these things, and then also if you start to make positive changes and you start to see your cycles get better, then all of a sudden you have the ability, you realize that you actually have the ability to impact your cycles in a positive way, to impact your health. I feel like for a lot of women, that's what they come to. And that's why this can be so empowering and powerful for women, because it really kind of puts that power back in their hands where it belonged in the first place, to be able to really impact their own lives in a positive way if they want to.
I really like the way you said that. Even just knowing that Yeah, there is like a normal cycle that we all aspire to, but that's not going to look the same for everyone. And some people are in such difficult situations with their health that their cycle is just typically very painful and they hate it. So yeah, it's sort of like through this method, being able to start to make those tiny steps and adjustments to make it just that much better, even if it's just like by a percentage of a degree, that is really empowering to feel like, you know, you are the one that's in control of understanding how to make these positive impacts in how your menstrual cycle feels every month. And yeah, I just think we need more space to be able to experiment with that in our lives, and it's hard because I think the easy fix is to be taking more medication, but it doesn't really get at the core issue that you're talking about.
Well, even when you mention like painful periods, I think sometimes it's just helpful to have somebody say out loud that although it's really common for women to have pain with periods, it's not normal. So I think I'm trying, this is something that I say to a lot of my clients, so it might not have been coming from one specific client experience, but I remember having conversations with one of my clients or several, and, you know, checking in about the pain, like what is your period like? How painful is it? You know, on a scale of 1 to 10. And it was kind of like, you know, 5 or 6. And I'm like, that's pretty significant. It's like, well, no, you know, my friend throws up when she has her period, so this is totally fine, right? Because this is what we do. We downplay. I know somebody who's way worse than me. Mine is nothing. And then I kind of said, well, you know, what if your male partner had that degree of pain in his penis for a couple of days every month? How do you think he would feel about that? And of course she was like, oh. And sometimes we need to throw it out of that context so that we can understand. Outside of menstruation, pain is typically considered to be a problem. And considering that a huge percentage of women with severe period pain have a, you know, underlying endometriosis, which can be an extremely debilitating condition that can really interfere with your day-to-day life and functioning and future fertility because it's associated with infertility. We should be actually paying attention to things like that. And we shouldn't continue to perpetuate this idea that it's just normal for women to just have these miserable, debilitating, crippling periods, and we should just be tolerating it. And for the record, I mean, for a lot of women, they find some relief with the birth control pill and with you know, heavy medication. And obviously, if you're in that type of pain, you gotta, I'm a proponent of using medication. I'm just not a proponent of suffering. So I had extremely painful periods for a long time. And I remember before I had children and I had these horrible periods, I remember thinking to myself, like, it would just be like this all day thing. At the end, I would be exhausted because it hurt so much. If I didn't take the medication in the window, I was just out for the count. Eventually, I would just like pass out and then wake up and the medicine, like, it was literally like ridiculous. And I remember thinking, like, after waking up and being exhausted, all this pain, I'm like rolling around, like I'm kind of talking about it flippantly, but it was really bad. But I remember feeling like, oh, it feels like I went through labor and there's no baby. So it's like pointless pain for no reason. And then now I do have 2 children. So I've been through labor twice. And the first time I went into labor, so with my eldest son, I literally, like, I didn't know I was in labor all day because I was like, it can't be labor. My period pain hurts more than this. Like with labor, I had these contractions and then I had like a break. And then, like, now I know that they were contractions. Before I didn't know that.
Wow.
But like, this is the kind of thing that as women, we actually just tolerate and think is normal. And I'll never know if I had a touch of endo, because I mean, when I describe that, I've described that to people a number of times, even health professionals, naturopaths and alternative health care professionals who are like, Lisa, that sounds like it's pretty bad. I suppose the good news is that you can improve it. Pain, especially with menstruation, is a sign of increased inflammation. If you look at the research, women that have significant pain have a higher degree of the markers of inflammation, like prostaglandins. And there's a lot of research to show that if you reduce the prostaglandins, there's, you know, if you think about all the things that could contribute to inflammation, and actively work on reducing your exposure to those things, and also, you know, address the inflammation specifically, you can make a really significant impact on your pain. But I guess for me, it's like bringing it back to, it's really helpful, I think, for people to say out loud, like, look, it's not normal to be in that much pain. you know, even if you've been in that pain every cycle for the past 10 years and you've just accepted it as part of life, I feel like it's always necessary for someone to stand up and say, actually, no, you shouldn't have to suffer like that.
Yeah, I think so many women have been told like, oh, this is just the burden of being female. It's like part of your life now, which is like, you know, a really sad way to look at it. And I think now like we're equipping ourselves with so many more tools to be able to manage it and really pinpoint what it is that's causing the pain and finding relief, even if it's not instantaneous, like shutting it down in the immediate sense, just getting those like little subtle cues of like feeling a little bit better your next cycle and even better the next cycle. That is like really empowering as well.
Well, and just to kind of put it out there, I mean, again, another thing that should be said is that if you look at your menstrual cycle as a vital sign and you take period pain, for example, that's an indication of a deeper underlying issue, which in that case is likely inflammation. It could even, you know, a lot of new research is coming out about endometriosis and how it can be related to immune dysregulation. And it's obviously an inflammatory disorder where you have endometrial tissue developing in areas where it shouldn't be developing. And depending on where it develops, it may or may not cause pain, because not all women with endo have pain. But if you think about it like that, the pain is a sign of something else. And so it's important to have relief. So however you get relief in the temporary sense is helpful. So I don't want to downplay the importance of that, but know that taking the pill doesn't solve it. It doesn't cure it. It doesn't fix it. It stops the menstrual cycle, you know, and then a lot of women may experience not even all women experience a complete resolution of the pain on the pill. So to put that out there too. But it's just important to recognize, like, there's a difference between treating symptoms versus actually trying to figure out what's the underlying factor and addressing it.
So I'm segueing into vaginal steaming, of course, and that's what we focus on a lot at Leiamoon. At what point in your research did you come across vaginal steaming?
Well, I mean, I came across steaming in a really interesting way early on. So I've been podcasting. I started the Fertility Friday podcast. It'll be 5 years this December, so yay. And I remember it was, I posted this article on Facebook, and it was like, Gwyneth Paltrow is telling everyone to steam their vaginas or something. Of course, I'm paraphrasing. I don't remember the exact name of the article. And I literally posted it like with the eye roll emoji. I was like, great, now we have to steam our vaginas now. What's next? We were talking about this before in our pre-chat, and I had never heard of it before. And I kind of thought that it was an extension on like vaginal rejuvenation. I thought it was like a negative, like your vagina smells and you need to clean it. And so I really just didn't know about it. And I just assumed that it was not a good thing. And so, but I remember, and I'm very thankful, and our Vigo practitioner checked me right there. She made a comment on the post and she's like, actually, Lisa, it's a real thing. You should look into it. I think you should interview Dr. Rosita Arvigo. And I was like, huh. All right then. And so very early on in the podcast, so going back to the archives, episode 18, I think it is. I remember it because I just referred to that one so many times. But I interviewed her, and in that interview, she was the first to really explain vaginal steaming to me, and also, of course, the audience, and the implications. So, and then much later on, I interviewed Kelly Garza on the podcast, Steamy Chick. Hi, Kelly. And she shared even more information. And so, you know, steaming has an interesting history, and it's associated with a lot of different things. And for the women who I've worked with, particularly helpful for women who are having problematic periods. So I've had a number of clients who, I think as women, we just have an intuitive sense of like, if you have your period and it's too dark, it looks black or oxidized. Or if you use a menstrual cup and you're bleeding and it's like molasses, like it's not liquidy like you would think it should be. So, you know, if you have that intuitive sense of like, this doesn't seem right, this seems like there's a problem. A lot of women who have spotting before and after their period, things like that, or even, you know, pain with periods. Many women find relief with steaming just by, and it seems too simple to work. Then I think that when I talk about steaming, some of the myths that come up for people, because there's always people that are like adamantly like, no, steaming is bad and you're burning your vagina, all that stuff. So steaming feels like a warm bath for your vagina. It's not painful, and the steam is never, if you are actually feeling any type of discomfort, you're not doing it correctly and the steam is too hot. So quite literally feels the same way you would go into like a steam room or a sauna or like have a nice bubble bath or something like that.
Okay.
It feels very comfortable, very nice, as I'm sure you talk about all the time. But basically with the steaming, it seems so simple because you just sit in there, like not a whole lot happens. It just kind of feels warm in your lady parts. But by steaming over the course of several cycles, many women notice incredible shifts in the quality of their menstruation. And yeah, it's something that I've seen time and time again.
So why do you think that happens? I mean, just as somebody who's really well studied in like the science-based evidence world.
I think that as women, we haven't had as much of an opportunity to connect with our physical bodies. And it's easy to forget that our uterus is an actual organ inside of our bodies. So I've had a number of interviews with different practitioners of abdominal massage therapies. So, you know, my conversation with Dr. Rosita Arvigo, I recently released a podcast interview with Dr. Jennifer Mercier, founder of Mercier Therapy. I had an interview with Claire Blake, founder of Fertility Massage Therapy. And I'm probably forgetting somebody, but one of the, and even I'm thinking of Isa Herrera. She wrote the book,
Ending
Female Pelvic Alchemy. She wrote like 4 books. But anyways, what a lot of people don't know as well is that your uterus is a really interesting and dynamic, incredible organ. It's really fascinating. And over the course of your menstrual cycle, your whole uterus actually changes position. So when I'm teaching about fertility awareness and teaching how to identify the changes in your cervical position, one of the things I teach my clients is that the uterus actually changes position and the cervix tilts, and it's in a different position during your fertile window versus outside of it. But your uterus has to have that freedom of motion to actually move around during your cycle. It's not like walk into town or anything, but this is always my little example of the uterus. I teach with my hands. All my clients are laughing. But if this was your uterus and this was your cervix, during your cycle, you know, as you start your period, it might be more like in this position, typically facing backwards. As you approach ovulation, actually moves. And so the tilt and position of your cervix changes, but your uterus has to have the freedom of motion to be able to move around, essentially. So if you have a woman that actually has some sort of issue physically, whether it's adhesions, meaning that the tissues are sticking together and the uterus can't really move where it's supposed to be moving and can't necessarily get into the right position and empty properly, and then you have old blood and tissue or something like that that hasn't fully emptied, then it would make perfect sense that if you kind of think about your uterus in a physical type way, if you work with somebody who's trained in abdominal physical therapy, you hear them talk about how they can actually palpate your abdomen and feel if your uterus is in correct alignment and kind of massage or palpate those areas. It's not necessarily like the same as getting like a regular massage, but they have to kind of get in there and make sure that it's in the right location and kind of ensure that everything's aligned. And if there's adhesions, kind of breaking those up, but basically helping to realign and physically, you know, moving everything around. A lot of women have significant improvements in all kinds of areas. That's the answer to your question. Like, of course, it could potentially have this incredible impact on women because we are talking about our physical bodies here. And sometimes we quite literally need some physical manipulation to address these period issues.
No, and that's such a good example, actually, even doing that one.
Oh, you liked it? You liked my uterus?
Yes. But I mean, I think that makes sense too, even just thinking of the laws of gravity when our cycle is trying to sort of shed our uterine lining every month, but the actual like physical positioning of that organ is tilted in such a way where it can't empty, that having that kind of physical maneuvering would be really, is it a contraction or is the uterus literally physically trying to move old blood or old lining or old tissue that doesn't serve anymore out so that it can re-prepare for the rest of the cycle to accept life if that's what you choose to do. So kind of it makes sense that the physical positioning of that organ is really critical to how it's able to kind of expel each month, as you said.
just imagine if it was kind of like a standard of care. So this is a conversation I've had with a number of practitioners in these types of fields. Mm-hmm. Imagine if it was just standard of care to have an assessment, have somebody who's trained in that area to basically do an assessment of her abdomen to find out if the uterus is in correct alignment, and a series of sessions or whatever it would, in combination potentially with steaming or castor oil packs. If that was just the standard of care, how different the world be. Because it kind of blows the mind, because it's a non-invasive type of there's no surgery. We're not talking about, what if this was done even before surgical? Like, we're not talking about surgical, we're not talking about medication. We're literally just talking about like this very basic non-invasive type of, it's hard to, I suppose it's, I don't know, the drug companies aren't interested in funding study that doesn't involve medication. Like, you can't dispense this. So that has something to do with it. But I think it's hard for us to wrap our head around the fact that it could be something physical, and by addressing that physical aspect of it, it could significantly improve.
Yeah, and it's such a basic kind of first step, you would think, to be like, okay, well, where is my uterus located, and how is it sitting? Also, the way it sits.
Hey, it didn't occur to me. Like, it didn't occur to me until I had these conversations. It was never, and I had pain for years. It never occurred to me until I had those conversations.
And of all of our organs, it does seem like the uterus, the way it's held in place, is so tenuous and nuanced, with just these ligaments kind of suspending it between your bladder and your rectum. It makes sense that it would potentially get moved around, and that these non-invasive ways are things that we can do for ourselves on our own, like at home, on our own terms. I mean, there's certainly several amazing therapists out there that are great guides for it, but ultimately, it could be something so basic if we had our own sort of techniques that we were taught, which I think our Vigo myoabdominal therapy, they do self.
Yeah, you do. You have the sessions with the practitioner, and then they teach you how to do self-care. It feels like the uprising of the kind of feminine wisdom. It feels like we're at a time where we're starting to kind of bring this back.
Yeah, for sure.
And it's so necessary. To me, it feels like women supporting women in the ways that would make sense for women. I remember I felt like that when I first used menstrual cups. So the first cup that I used, Keeper, back in the day, like the year 2000, circa 2000, before there was, I know, throwback. Before there was like, now there's like 100 companies that make menstrual cups, but before that, there was like 2. And I remember like the first time I saw this and used it, I was just like, whoa, this is what happens when like women solve problems for women. Like, it just makes more sense. But maybe
the cup was such a revolution too. Like, even what you're talking about, being able to see your blood and assess it and know like when it's off or when something, weird is going on. The cup is like kind of the first way where we could actually like hold our period. No, but even that was like really revelatory, to be able to like hold, this cup of your own blood in your hand, to like really investigate it. Because for so long we were kind of conditioned to use tampons, plug it up, like don't look, hide it in the trash bin. Oh, I'm not. No, yeah. Andrew's commenting right now.
But I remember when, this is literally like throwback to year 1 university, but on my university campus, there was a women's center, and they had all these really great speaker series things and presentations. And I went to this one, and they were talking about the issue with conventional pads and tampons and how they're laced with synthetic chemicals and dioxins and all that kind of stuff. And I remember they just took a glass of water, like very much like this glass of water, except this has this lemon water. They took a tampon and put it in the glass of water, and you saw how it would expand. And then after they pulled out the water, you saw the little synthetic fibers in the water. If you ever want to do that, you'll be grossed out forever. But when you actually have your period as a woman, it's not blue liquid, it's not water, it is blood and tissue. And so having the cup was one of those kind of revelatory moments of like, this actually like addresses what I actually have. It's not uncomfortable. If I have a lighter day, it doesn't leave me feeling really dry and uncomfortable, when I pull it out. Like, I'm not necessarily dissing any type of products except for the ones laced with the chemicals and the dioxins. But really just, I just had that moment of like, this is made for women by women. This is what happens when women create solutions to the problems based on what we feel would intuitively be better.
Yeah, so much. And if we are talking about being able to assess, the result of your cycle each month, that's such a great resource, way to really get in there and understand what's going on and what this is. And sometimes, I really just feel like having that understanding, physically see it in a way, and I think that acknowledgement is already helping women understand it, and what might have been translated as pain before might actually not now, if it's connected to some new logic that you're able to find as a result of really like seeing your cervical music and mucus, and your menstrual blood.
Well, and the way that I've looked at it over the years, kind of like the way I joke about it is I can't, because I've been charting for so long, I can't really go off the rails. Like I can't really go on like a crazy 3-month sugar binge and like drink all the alcohol and like never sleep. And like, I can't really do all that stuff, because when you're charting, you actually see how it quite literally affects your cycles. My cycles have always helped me to stay on track. It gives me an indication of, that what I do with my body, how I take care of myself, all of these things, why it matters and why it's always good to go back to the basics. A lot of us want to really think, oh, I have to take all of these supplements, I have to do all these things, I have to completely change everything I'm doing. But often it starts with like getting enough sleep and sleeping in the dark and not eating all the sugar, and it can be really a lot easier than or a lot more straightforward, a lot more basic in many cases, at least in the initial stages, than we often think.
Sure, and like I think that is partially why I really appreciate vaginal steaming too, because it kind of gives you this like ritual or marker and it depends on when you steam, but I usually was steaming before I got pregnant.
Yeah.
Just a few days after my cycle as a way to kind of reflect on what happened, like what did I do over the course of the month that might have caused my cycle to be painful or to be easier. And even in just steaming itself, it was making my cycles easier. So even that, like combined with, tracking your cycle, is a really good sort of, consistent time to spend giving yourself that assessment.
Well, and when you're tracking your cycles, so for instance, if you ever make a shift, so if you start steaming, if you pay attention just to a few things, you can pay attention to the length of your period, the color of it, the quality of it. You can kind of make note of the things that are important to you. And that's what's really helpful as well, by having a record of it, because we really quickly gravitate to the new normal and often forget where we came from. So if you have that record of several cycles, and then you can say, okay, I started steaming in January, now it's April, and you can actually kind of take a look at the changes that you experienced. It really gives you a good indication of whether or not you're on the right track, and if what you've been doing has been helping you.
So much. Well, I don't want to keep you too much longer. It would be very easy to do, but thank you so much, Lisa. I really appreciate all your wisdom and everything that you share, encouraging us to embrace our hormonal changes and know them intimately as a true indicator of our overall health. Everyone, please check out Lisa's book, The Fifth Vital Sign. It's pure gold, especially if all this information is new to you. There it is.
I asked my designer, I said, I want it to look like a vulva, but like not like a vulva. I was like, I want it to look like a vulva in an arty way. So how did he do?
Yeah, beautiful. Turn to nature. Nature always provides.
Yeah. Whenever I show it to men, they're like, I see it.
No, and I mean, even just like that, like all the content is broken down in such a clear, palpable, stylish, fun way that I highly recommend giving it a read. And if you head to fertilityfriday.com, you can see more about Lisa and what she has to offer. She has consultations on her website. And again, her podcast, Fertility Friday, is the best. I love it. That's how we found her. And for those of you who haven't signed up yet, head over to our site, Leiamoon.com, to reserve your home electronic vaginal steam seat. We're getting closer to our countdown of launching our Kickstarter, so stay tuned. And yeah, stay in touch. Lisa, thanks again. It was really a pleasure and a really privilege to spend the afternoon with you.
Thank you. This was so much fun. Thanks so much for having me.
You're very welcome. Bye, everyone.